Hello, podcast listeners. We know podcasts are a great way to catch up on a program that you may have missed on KSJE, and it's provided as a free service of this radio station. But you know, KSJE is now listener-supported, and so while you enjoy this podcast, we hope that you'll also take some time to join KSJE. Become a member today. It's quite easy to do. Just go to our website at ksje.com/support and pick the level of support that best matches your budget. Thanks again for listening. Here's your podcast. 11 minutes past 8 o'clock. It is Monday morning, the 4th day of August, 2025. Good morning, everyone. I'm Scott Michlin. Thanks for tuning in to KSJE 90.9 FM right here in San Juan County, New Mexico. In Durango, Colorado, we broadcast at 103.3 FM. And if you're listening to my voice anywhere else on the planet, you've gone to our website to stream KSJE at ksje.com. Or maybe you're listening through the new KSJE app. Glad that you are with me this morning, everybody. Also, want to welcome our viewers to the program. This program is streaming out with video to the KSJE Facebook page and also to our YouTube channel. So welcome aboard, everyone. So glad that you are with us after a busy week here in Farmington and here at KSJE. Congratulations go out to the Doolin Dodgers of Texas. They are the 2025 CONIMAC World Series champions. You heard the action right here on the final game on Saturday night. Congratulations to them, winning over the Southern California Renegades. And thank you all for your support and all of our sponsors and underwriters who supported our broadcasts of the CONIMAC World Series last week here on KSJE. Now, coming up this morning, though, I want you to know that coming up, a very important conversation with the CEO of San Juan Regional Medical Center. Healthcare has been in the news recently, lots of potential changes coming, and we'll talk about some of the national issues and local issues that are going on as well in healthcare with my guest Jason Rounds in the next few moments right here on KSJE Today. Later on this hour, I'll be checking in, of course, with Lewis Campbell from Synergy Computer Systems. That's our Monday Reboot segment. We talk technology today at 8:50 a.m. right here on KSJE. Next hour, of course, Mick Hess is going to take us roving with the arts. That's our classical music program on KSJE coming your way at 9:06. Don't forget, you can also connect with us on our Instagram page, our Blue Sky account, or our X, formerly known as Twitter, in addition to Facebook and YouTube. And there it is. If you're a podcast listener, a reminder, you can find our podcast wherever you listen to podcasts. So check it out and maybe discover a new local program that you may have missed, or go to the KSJE app. The podcasts are right there, ready to listen to. You can download it today from the App Store or Google Play. Outside our studios here at San Juan College this morning, it's sunny and 62 degrees at the moment. We're expecting a sunny week, as a matter of fact, and a warm week as well. 91 for a high today in Farmington. Clear tonight, the low 63. Warmer tomorrow, 92 on Tuesday, 93 on Wednesday, 94 for Thursday and Friday, and overnight lows, as you can see, in the mid to upper 60s. Back with my guest, Jason Rounds, CEO of San Juan Regional Medical Center, right after this. KSJE is supported by San Juan Regional Medical Center. The most important ingredients to sustaining health and wellness are the resources and tools that help you live a vibrant and healthy life. At San Juan Regional Medical Center, the goal is to promote health by making sure those resources are available. Find the path to the best life at lifebetterhere.com. San Juan Regional Medical Center. Better is our mission, improving lives through personalized health and care. And back in Studio A with my guest this morning, as I mentioned, the CEO of San Juan Regional Medical Center, Jason Rounds, is here with me this morning. Mr. Rounds, good morning. Welcome back to KSJE.
Oh, yeah. Great to be here.
Good to have you back to talk about all things healthcare in 30 minutes. Not a problem, right?
I can pack it all in.
I bet you could. But there's a lot going on. I first wanted to talk a little bit about the new hospital that is being built in Farmington. And so they're building literally across the street from where we are this morning. But what's your thoughts about it, or what are you hearing so far, I guess, is my question.
Right. You and the community may know as much as I do. You'll be surprised to know that they still don't invite me to their morning meetings. But it's coming to town. We've known they've been coming for a long time. It's a for-profit venture based out of Texas. We are expecting them to be open by December, so that's kind of consistent with what they have been publishing as well. It's not a full-service hospital, which they've been marketing as well. It's really going to be kind of a niche. So we've been focused on our role in the community and what we need to do that to make sure that we are there for the care they can't provide. So if you're having a heart attack, we want to make sure that we have capabilities to transfer between facilities seamlessly. We've worked with our partners in the county to add another ambulance truck and crew to that'll be coming on board to make sure that we can address the transfers that are coming out of that hospital system.
Got you. But for right now, that's about all you know, and you're kind of watching like everybody else.
Absolutely.
Like.
So we're paying attention to their marketing pieces, and we'll see how it goes. But we're thinking December.
Okay. All right. But the difference is, I guess, is that they're for-profit. San Juan Regional has always been a nonprofit community hospital, and so maybe those visions, long-term goals are a bit different.
Well, we are for the community, of the community, and really serving the community. We've been here 115 years. We're planning on being here another 115. We do have a somewhat unique structure in the hospital systems in that we're independent, not-for-profit, community-based hospital. And our corporation, which you may be familiar with, is somewhat unique in the system. It's comprised of 64 of the 100 or 30 or so not-for-profits that operate in San Juan County.
Right.
So that's where we draw our board of directors, and so our leadership and our governance comes literally from the people that we're going to see on the baseball fields or at the grocery stores or at the school events.
Right. Very community-centered and based, it sounds like, too.
100%.
Even structurally.
Absolutely.
Yeah.
It's in our DNA, so to speak.
Right, exactly. There you go. The other thing I want to ask you about, too, we recently announced a big partnership with San Juan College, where we are this morning, and San Juan Regional Medical Center with the nursing program to provide maybe some future grow your own nurses. Is that the idea?
Absolutely. So I've been in healthcare for a long time, and this is certainly one of the most significant partnerships that I've been a part of. So really since COVID, there's been a caregiver shortage, so nursing specifically at the center of that. It's not unique to Farmington, it's not unique to New Mexico, it's a nationwide thing. And so for the first time, I really feel like we have been able to respond in a meaningful way to address this. So our partners at San Juan College really have stepped up to do something unique. They're going to be increasing the associates program by 50%. So that's an additional 32 students per year that would qualify for that. So a number of support programs. So we're supporting faculty, some equipment. We're also going to be providing scholarships to students who need that for a commitment to work in the healthcare in this community for a period of time after they graduate. But for the first time, we really have a program that if this will be successful, and when it is successful, over the next 5 to 7 years, we'll make a significant dent in that shortage for Farmington. So this is hopefully the start of programs that will look more like this in the future.
Got you. And so the idea being is that the students will come to San Juan College, get some nursing certifications and degrees and things like that. And if they get some scholarship assistance, perhaps then they make the commitment to work at San Juan Regional Medical Center once they graduate with those certifications to kind of pay back the support that they received. Is that kind of the idea?
I think that's a good summary of it. So this is the RN program. So this is the associate's degree. So the folks that are coming out there will be registered nurses. That was the focus of that effort. Working with our partners, we recognized that there were a number of highly qualified students that were being turned down just because of capacity issues within the program. So we worked together to address that specific need to make sure that anybody who is applying here has the opportunity to actually start that class. In addition to that, we're worked with our partners to say, so what are other issues?
Right.
And the attrition. So people will start that program and life happens. It's just like, oh my gosh, family needs or financial needs or likewise. So we put on our creative thinking hat on how we can support the students directly to make sure that they matriculate, they go through the entire program. And so for that type of support that's coming from the hospital, we're asking for a commitment to work within the community and at the hospital. So
I see.
we also think that if we can get them into that program and into our system, that they'll be happy there for a long time. So
Right.
it's a great recruitment opportunity for us.
Nice. Well, and again, you know, and your recruiters know probably that the great way to find someone who's going to stick around for a while is maybe if they have roots in the community or family in the community or they know the community. It's a lot easier maybe than trying to bring in someone from outside who may not be I don't know, maybe used to a different type of community. I'm thinking maybe more urban community or what have you, before even coming to our state, which is certainly maybe a unique state as well if you're coming from a place like California or the East Coast or what have you.
Right. So I think when we originally started talking about the program, that was certainly our intent. We knew that there were local people here already that we didn't have to convince them that Farmington is a great place to live. We wanted to benefit from that, but really kind of going through this program and talking with the key folks from San Juan colleges, we've recognized there is a big draw outside of this community. And once again, Farmington sells itself, the area, the Four Corners sells itself. And so getting people and giving them a little bit of an extra push to come to this community and be in this community and stay in this community, it's kind of a full spectrum approach.
So you wouldn't turn anyone away?
100%.
If they're local or out of town, it's okay.
Nope.
They can be.
If you want to be a caregiver and in healthcare, the noble profession, and you have inclinations to do that, we want to be able to support you in doing that.
Nice, nice, very good. And again, as you said, this is a 50% increase in the number of students getting into that nursing program, whereas before it was really just limited because of, I think, just capacity and staff to teach and those types of things, and that's now been eliminated with this partnership.
I think it's a start.
Mm-hmm.
I don't know how Dr. Pendergrass sees this, but our friends at UNM and New Mexico State have kind of thrown down the gauntlet in some of their statements, talking about doubling the capacity of their programs throughout their entire health sciences program.
Okay.
So I will tell you in my conversations with my hospital association is we seem to be at the vanguard. We're actually executing some things now and specifically can point at it and say, we have accomplished this. We have a program that we're now going to actually be able to increase our class size starting this upcoming semester.
Nice, very good. And those jobs will be there when these folks complete the program. They're there today, probably.
My goodness, yes. So there's over 300 nurse deficit in San Juan County alone.
In San Juan County alone, not the state, but San Juan County.
100%. So start magnifying that. So 6,000 deficit within the state, nationwide, and others. So if you are interested and worried about having a job when you graduate from college, healthcare is absolutely a great way to go.
Almost guaranteed, it sounds like to me.
100%.
So very good. Well, that's important. And I know, at least speaking for myself, I'm not getting any younger. So it's nice to know we'll have some caregivers in the community for the future.
We may be checking close to the same box.
I don't know about that, sir, but that's okay. But that's a great partnership. And again, I think that's one thing that San Juan Regional and San Juan College do very well. And the governments, too, here in San Juan County, the cities in the county, they seem to kind of work together to try to figure out how to fix a situation, whatever that may be. So that's what I've seen in my career here.
Absolutely. I have never lived in a community that the collaboration and the partnership was as well orchestrated and defined as it here. So working with the county on projects, we're opening up our childbirth center in September. We're going to have the ribbon cutting. That was a 5-year project in the making, and it never would have come to pass without the support from the county. Our partnerships with the PMS and the county and the city and other municipal organizations on the TOTA support for our sobering centers and developing the crisis center in there. That's real commitment from a lot of disparate people doing the right thing for the community.
Yeah.
So there's not a lot of debate about your problem, my problem, their problem. We recognize that it's our problem, and that's really drives a lot of the creative solutions.
Yeah. Well, and again, as a community member and a board member of Presbyterian Medical Services, it's nice to see that and see, how our community treats maybe the most vulnerable among us is really a nice thing that reflects back on the entire community, which I think is really an important thing too.
Absolutely. So it's a pleasure to be here and have that level of support.
Right. Well, very good. I want to move on and talk to a little bit about the legislation recently passed by Congress. This big, beautiful bill had some impacts to healthcare, I think, in it, and it may be kind of a more recent thing, and maybe you're still kind of delving through to see what's going to trickle down, but we keep hearing in some newscasts and things that some rural hospitals may be at risk. They may close. I don't know if I consider our hospital a rural hospital, but I wanted to ask you about that to see what impacts are you watching for, or is it still too early to tell? What are you learning?
So you packed a lot in that question.
I did. I really did. I know.
So for us here at San Juan Regional Medical Center, so the rural designation, so it depends on who you ask.
Okay.
So from a Medicaid perspective, we are considered urban.
Okay.
But we have a foot in each column, so to speak. So for Medicaid, we're urban. For some HRSA grants, we may be considered rural. But regardless of that, our area is considered medically underserved, so that activates some other programs.
I see.
So a lot of specifics that don't really matter. Our concern about Medicaid overall is valid. There will be a reduction in Medicaid. So the federal government overall wants to cut about $800 billion out of the Medicaid budget over the next 10 years. That's clearly impacting every state. Our governor has been on the circuit talking about that and what the impact is. So for us specifically here in Farmington, with the Healthcare Delivery and Access Act and the work that our local legislature did, we brought new money to the mix. So we were concerned.
State money.
Well,
yes.
It's money that it's an
federal money through the state.
It's an assessment to the hospitals that go to the state. The state can then send it up to the federal government and get a match to bring it back down that goes back to the hospitals.
Okay.
So we were the 49th state out of 50 to finally kind of maximize that program. So for us as a healthcare system, this was significantly new money that was into the equation. So we had concerns about, is it really going to happen? Is it going to be impacted by the big beautiful bill and all of that? So we were careful about what we were doing with it and how we were accounting for it, even this year in our own financials.
Concerns because it may not last, I guess.
Or it may not even come to pass.
Okay.
And so there was a lot of moving pieces. But the program was activated. The mechanisms did work. The money did come in there. So
you cashed the checks.
Absolutely.
Good. Okay.
So for this year, we know it's there. We're relatively confident for the upcoming years. And for really the next 5 to 10 years, we think programmatically it's going to be there in some capacity. So here we're planning for this new money that's coming to Farmington to be less than it is now. So our best estimates are with the new work requirements for Medicaid,
right.
So some of the reductions in that, some of the caps that they're actually putting on this program that will impact the mechanism for Healthcare Delivery and Access Act, there'll be some reductions. So best guess right now is sometime between 5 and 10 years from now, it'll be 25 to 35% less than what we get now. So once again, we didn't count on it. It was a nice pickup this year, and so over the next couple of years, we'll be able to determine what's really stable, how do we build that into our budgeting, and how confident are we going to be that it's going to be here for a long time.
Gotcha.
So that's us.
Right.
So back to the comment about concerns about rural hospitals. Those concerns existed before the big beautiful bill. It has just made it even more urgent and concerning. So reductions in Medicaid will impact these hospitals directly. Reductions in the Healthcare Delivery and Access Act funds will impact some of my colleagues more so than me because they really needed it at a level for sustainability. But there are other factors that we were concerned about really affecting the same hospitals. Malpractice and some of the other things that existed before the big beautiful bill were really potentially impacting those same facilities in a way that reductions in Medicaid or otherwise. So just kind of the nature of rural medicine and kind of the thin margins they were on anyway, anything that's going to dramatically increase the cost or reduce the revenue is going to have a dramatic impact.
Gotcha.
So
right.
As we're planning, as we have a relatively good idea of what's going to happen to us in the big beautiful bill, what we're doing next is actually reaching out to some of our surrounding colleagues, like so our friends in Gallup, the Indian Health Services in Shiprock, for example, to really kind of understand within this construct, you are funded a little bit differently than us, so what are you anticipating? Because if something happens to those facilities, the need for us goes up differently. So,
sure.
Planning for a 6 to 10% reduction in Medicaid volume here locally, just directly, takes on a whole different meaning if suddenly I have 2 other hospitals that can't take the same number of patients or their service lines are restricted. or some others. So we're really trying to get a better idea of what's going on around us with our friendly competitors.
Got you. And so that's important to note, and I guess important for patients to know too, that that's kind of everything's a little bit in flux as you kind of see where things fall, I guess, after this legislation.
Absolutely.
And so with that, with changes maybe to IHS or Gallup, if someone's living kind of in between the two facilities, I guess, and they say, well, I can't go to that hospital anymore, I'm going to come to Farmington, that increases your patient numbers, I guess, which can be a good thing in some areas. But again, you need the staff and the capacity, I guess, to deal with those new patients that are showing up at your door, whether it's the emergency department or just they need a room.
Right. I talked to our corporation membership last night and really talked about the fact that from a size-wise standpoint, we're at this inflection point that we're at a size that we can't really stay where we are because we have bigger needs, investment in IT and some of these other main overheads and how we're expanding to address the access needs in our community. So the need to grow is imperative, and we have a great opportunity to do that. And nothing that we're directly seeing from the big beautiful bill or otherwise is really going to interfere with our ability to grow in the measured way that we want to. So really addressing the community health needs assessment, which we're about to update again, recognizing the vast need for healthcare services in our community. So what we're struggling with is, back what you said, is our ability to take the demand that's out there today. So we're already turning away patients because of capacity issues that we don't want to turn away. And so our mechanisms and how are we going to grow sustainably and reasonably to make sure that we can address that demand is already challenging for us if our friends around us are having additional challenges or, God forbid, go out of business or however that looks, is that need just increases. So our need to be able to expand quickly is going to be challenging in an already challenging market.
Got you. I think I understand that. But again, it sounds to me then from the standpoint of San Juan Regional Medical Center and this bill and this legislation and that's been passed, the hospital seems pretty stable and on stable financial footing, and there shouldn't be any concerns of this hospital shutting down services or closing its doors or things along that line. We are not in that type of situation. We meaning you.
Yeah,
in the hospital, but our community hospital.
Our community hospital is financially sound, and everything that we see in the future, we're going to remain on that firm footing. I think any changes to Medicaid, and once again, if a meteor strikes and Medicaid goes away or substantially reduced in some way that's unpredicted, we'll have to take a step back and kind of reassess that. But right now, for what we see in the next 5 to 10 years, is we have a good plan. We plan to remain sustainable. We have to do the blocking and tackling and the efficiency of care and all that great stuff.
Sure.
But we're really looking at our opportunity to prioritize where we can have the best impact as far as access to services in our community.
Got it. Thank you. And I think, though, in other communities in our state, in New Mexico, that is a very different conversation, probably a smaller community with maybe different resources. I'm not going to ask you to speak for them, but I would think that there are some hospitals that maybe were kind of struggling before, and maybe with this, they're even more precarious. And I'll leave it at that.
No, I think that is an absolutely fair statement. We recently attended our planning session with our hospital association, and so it really is distressing talking to some of my colleagues about the financial challenges that they already had before the big beautiful bill and what they're really kind of facing going forward to make sure that they can address the needs for their own communities.
Right.
So it is an urgent situation for New Mexico. And I am grateful that I live in this community and we have a structure in place to where we are planning for growth and increased access, and where we kind of beat ourselves up on is like, okay, how can we do this better,
right,
faster, and improve that care experience here. So it really is some of the basics to healthcare.
The conversation sounds like it's still about growth and just a way to do it smartly going forward, not cutting back or things like that. It's still a growth mode at the San Juan Regional, it sounds like to me.
Correct, I think. And as we always do, we're going to talk to our community and really identify those priorities. We can't do everything, But we want to make sure that we're investing in the areas that will have the most impact.
Got you. And I do know that there are probably some listeners who are yelling at their radios right now saying, but there's a fund to help rural hospitals, and that may be true. And we hope that if there are hospitals like that in New Mexico that could use additional funds to kind of help them through this transition, that will be made available, and we won't see a decrease in health care, because it seems like in our rural state that's really important, especially when some of these hospitals are serving patients that travel tens and dozens of miles and hundreds of miles just to get into the door.
No, absolutely.
And that's a unique situation that we have that maybe some other states do not.
Also, absolutely. And
Yeah.
what I've learned in going to some of the national meetings is every state has its own unique challenges, and
Right.
New Mexico certainly has its own.
Very true. I always like to talk to you a bit about economic development, because as I hear from those folks
Yep.
that healthcare is an economic development driver in the community, in our community. It's been kind of noted as a thing that can be used to provide economic growth, and that's, I think, something that you have embraced, your board has embraced, and we see some of the things by being that kind of regional center for different procedures and hiring these really expert physicians and others to provide that type of care that folks can't get without having to travel 300 miles away or 200 miles away,
Right.
or what have you. And so that's still an important part of the future plans too.
Absolutely. So there's so many ways you can look at this. And so I was kind of trying to figure out a way to describe this to my corporation members. Just like, what is the impact? What does our community hospital look like as an economic driver? So my friend Copilot, the AI support for Microsoft, and I were having a conversation. And I asked it to kind of compare us to known national companies. And so from an impact standpoint, from a net revenue standpoint, employees a little bit,
Right.
we look a lot like Yeti. We look a lot like the company Crocs, the shoes.
Okay.
We
Coolers and shoes. I'm with you.
I know.
Yeah,
I mean,
okay.
you kind of divide. We look a lot like Roku, the streaming device for
yeah, okay.
TV. So brands that you may recognize and see on the shelves in there, it just kind of is a different perspective. Oh, my little community hospital, I didn't realize that it would have kind of the same economic impact as some of the known national brands.
Right.
So that's significant. I also, in my previous life in another market, would always go to the chamber and say, you realize every physician that we recruit to this market is equivalent to a small business. So we've added 20 providers over the last year, and we are still recruiting for these key areas. So every time that we land one of those, not only are we getting a well-paid person who's going to live in our community, shop at our grocery stores, but we're also adding staff to support them and billing operations and behind the scenes equation. So it's an economic driver just by the nature of that type of organic growth.
Right, very true. And that seems like a large number to me. Is that higher than usual for a year to hire 20 extra or attract 20 extra physicians to the community? Or is that a good year?
It's been a great year,
Okay.
but we've also changed our approach in how we're doing that. So recognizing it is challenging for an independent provider to move to New Mexico. There are a lot of barriers to that. New Mexico was the only state in the union that lost doctors statewide last year. And so
Ouch.
we've got to drive that. So up here in beautiful Four Corners, we were bucking that trend. So we are adding more than are retiring or leaving the community. So it was a good year, but we have a lot to celebrate up here in the Four Corners. It's an attractive market, people who love the outdoors, and a wonderful community and lots of things to do around us are attracted to this area. If you want to live in New York City, Farmington is not your place, but if you love everything that we have to offer here, which is a lot, this is a great, relatively easy place to recruit to.
Right, right. Well, that's good. And again, really important to talk about kind of getting these professionals to the community. And sometimes it's an easy sell for your doctors. It's maybe the harder sell for the spouses, maybe to get them to sign off too, to say, yeah, let's do it. And so there's a lot of quality of life issues that I think the city recognizes, the county recognizes, and I think the hospital recognizes too, to be able to kind of sweeten the pot a little bit with, there's this, and this to do when you're not working, and maybe take another look at what we're offering you.
Yep. No, I think that's part of it. And I don't know how much of it is myth or expectation, or it's always been challenging, or just kind of a little bit of stuck in a rut of perception of what's available here. But people who move here from other places are blown away at what's available here. The support that the city gives and the community and the investment it doesn't take a lot to look around that there's a lot of growth going on here. It's like just try to drive to work every day and you see the construction and everything that's going on here. So there are some, big ticket stores that may not be here, but what's available in the surrounding area is just absolutely amazing.
Right. I think that's true. Very true. And so that's important. The other thing I want to ask you too about economic development is some of these specialized services that you offer too. I know the hospital spent a lot of time and resources to attract cardiologists and developing the heart center and things like that for different types of specialized treatments. And is that another area of specialized services that you look at for potentially economic growth as well, that maybe would keep folks from having to travel out of town?
That's great, and that's part of being smart about what we're investing in. And so we are not going to have the volume or need to be a transplant center.
Right.
But our investment in cardiac services and those type of critical needs in there, which we've been known for a long time. So that's a critical focus for us. We are recruiting 6 providers at the moment. We would love to be able to do that. Talk about, different specialties can be different challenges.
Right.
But we really are focused on that. We've made great progress over the last year in our gastroenterology program, where we've fully staffed GI hospitalist service that's really kind of helping us decompress our inpatient needs. We still have 2 positions that we're recruiting for on an outpatient basis that will really allow us to start really cutting into that backlog of patients that we would like to see. On the other part of the equation, there is the stuff that makes great business sense and supports the community needs and others. There's also some mission-based things that we do, like neurosurgery. Is we're kind of in that cusp area is the volume of need within our community really support that or not? But if you really look at, if we didn't have neurosurgical support, the closest would be Grand Junction or Albuquerque or Phoenix or Denver. And if you can imagine falling down on the mountain and bumping your noggin, you probably want quicker access to that.
Right.
So there are programs like our neurosurgical services, behavioral health, that we're investing heartily in, knowing that it's the right thing to do for our community. We've also, speaking of behavioral health, over the last year we've hired 2 psychiatrists. We've rounded out our inpatient service. We've recently hired an outpatient psychiatrist that will be joining that program as we're doing that. So we really are investing in a large way to help drive the behavioral health need in our community.
Nice, very good. Well, and again, we always hear about how important that is, and it's important to have those resources in the community. Again, I think another partnership that the hospital has been there for is this new navigation center and a place to be able to let folks go in and kind of a one-stop shop to get referred and resources to some of these things that we are talking about. So that's another important thing that the hospital does to support in the community too.
Right. There are a number of programs that are available in there, and we're happy to be just a piece of that puzzle as we go forward. But our partnerships, there's a new crisis center that's being contemplated in partnership with the community that will effectively, from a provider standpoint, be a game changer for our communities by being able to decompress EDs and our jails and other areas and get people into an appropriate to address their immediate crisis needs.
Right.
It allows us to invest differently in the wraparound support services, so intensive outpatient services or other inpatient services that may be appropriate.
Got you. And I think you're right. A lot of these things, too, that have been implemented are ways to maybe try to keep the stress off of the maybe emergency department and try to find maybe a more appropriate level of care for whatever that individual is going through. It may not mean a visit to the emergency department. It might mean a counselor or a mental health professional or someone else besides someone at the ED.
Yeah, absolutely. It's really been a joy to work with a community that recognizes that this isn't a law enforcement issue. This is not an ED issue. This is a care and supporting our community issue.
Right, and that is saving, I think, a lot of public dollars too by providing those resources at the appropriate level for what that individual is needing.
I know from our standpoint at the hospital, when we run the return on investment of programs like this, it's substantial because it allows us to treat the patient at an appropriate level, and it helps us have the capacity to be able to treat the patients who really need the level of service that they're coming in for.
Right. Very true. Well, Jason Rounds, I'm afraid we are out of time for our conversation today, but I always appreciate being able to sit down with you and hear your thoughts and perspectives on what's going on. Healthcare is so complicated for many of us, and so it's always appreciated that you come in and try to at least peel back the onion a little bit to let us know what's going on in your industry. So appreciate it.
No, thank you so much. I appreciate the opportunity.
We'll come back anytime.
Thank you.
Good to see you. Jason Rounds, CEO of Salmon Regional Medical Center, my guest here on KSJE. Did you enjoy that podcast? We hope that you did. And if you did, share it with your friends. And if you really want to keep podcasts like this coming, please support KSJE. You can do it easily online at ksje.com.